One of the things that, I mean, everyone's kind of talked about it, so let's talk. There's no one from healthcare on our panel here, but let's talk about it. One of the things that I found in the coroner's report when he testified was that 72% of all heroin-related deaths from 2012 to 2014 had been prescribed controlled substances within 2 years of their overdose death, and 50% of those were opioids. So clearly, medicine has played a role in this, and similarly, all these people had been within the healthcare system. They all had a doctor, and they all could have been diverted to other pathways to pain medication. What role has healthcare played, and how much more should healthcare be stepping up? I mean, we've kind of mentioned it, but let's talk about it.
I'll tell you a story that really turned me to be much more passionate about this. It's from one of my own members, and long story short, 7 years ago he was in a car accident. He's now in his mid-30s, or was in his mid-30s, and over-prescribed pain meds. Now, part of it's the medical profession, right. Part of it's he kept asking for them. Let's be fair, right? Long story short, the family spent 6 years helping him find a program and a pathway to recovery. Last Easter, thank you God, after a year of sobriety, he drove from Tennessee to come home and see his dad and sister. That ride hurt his back. He drove back home. He went and got heroin to cut the pain, and he's dead. And you talk about devastating.
Right.
And it really paints the picture of, what is appropriate pain that we need to live with? What are the pressures that we're putting on our medical profession? And I think again to the question, really what is the responsible use of pain meds, and what are better paths, healthier, natural paths to deal with pain? Right. And I think the medical profession, again, all the conversations that I've been involved with in this, I think they're certainly working to address it. But again, it sounds like I'm going to be repetitive for the sake of being repetitive. Until the collective will is so strong that we all say, this has got to change, they're going to continue to do what they're going to do until we say enough is enough, and we need to find a better way to manage pain and to manage through the situation.
I actually would like, on behalf of the Adams Board, to share a very positive, and I'm optimistic about growing our conversations within, I'll say, Metro Health. Mm-hmm. In particular, we have supported the funding of the Project Dawn, which helps to distribute the Narcan kits this is going into our third year.
Dr. Papp's program.
Yes, Dr. Joan Papp's program. And in conversations with her as recent as 2 o'clock this afternoon, but just as an example of me sharing out loud, we need to really grow our collaborations. They have ideas around medication-assisted treatment. You know that Dr. Papp is spearheading these conversations within the hospital. As Judge Matia acknowledged the limited number of positions we have in a county that is rich in healthcare. 30 is less than 1%, I'm confident. Don't remember how many zeros behind the decimal would reflect it, but I'm encouraged, is what I'd like to convey, that we have had conversations, Metro to start, and it's my plan to have similar conversations along with our partners with our other healthcare environments.
I'd like to be a part of that.
Absolutely.
Yeah. It's clear, to answer your initial question, that we wouldn't be knee-deep in heroin deaths without the overprescribing of medication. In Ohio, from I'm a statistics guy. We're not dealing with just anecdotes here. Right. From 97 to 2010, the average per capita pills per Ohioan went from 6 pills to 67 pills. From 97 to 2010. If you chart the overdose death rate per year, the statistical correlation between the rise in pills and the number of overdose deaths was like 0.946. It's almost a perfect one, and any mathematician could tell you it doesn't get any closer to that. So the evidence is clear. The overprescribing of opioids brought us on this problem. The United States is 5% of the world's population. We consume 80 to 85% of the world's opioids. Our own medical profession does not follow science in regard to prescribing practices. If they did, other countries would be prescribing, other first world countries would be prescribing the same rate. Opioids are not appropriate for most non-acute pain. The scientific literature studies show that you prescribe an opioid, you have, first of all, the patient uses the healthcare system more than. You want people to use the healthcare system less. They are more likely than folks treated otherwise with things other than opiates to use other illegal drugs, i.e. heroin, and their healthcare outcomes are worse. The literature is clear that opioids are very ineffective generally in healthcare. The question is, why has the market been flooded? Why have medical professionals that we turn to, that we trust with our lives and our children's lives, why have they failed us so badly? I'm sure many of your readers with MDs are going to be unhappy with my comments. I don't care anymore. I see people die, regularly that I know, that I've had in drug court. Fortunately, we've been pretty lucky lately, but we lose more people now every year to overdose than we lost in the entire Vietnam War. The statistics have made us grow numb at this point. Until it happens to somebody you know or remember, then you just can't read the stories anymore. We need to focus on what Ms. Hoover's talked about, partnering with our healthcare providers, demanding that they come to the table, not asking, but really demanding at this point, that they start working with us we could start a Favor the Waiver campaign for primary healthcare physicians. Get them, it's an 8-hour course, then you're authorized to prescribe buprenorphine. That's not enough. We need to have the peer support specialists placed in the emergency rooms with a doc who can prescribe, if that peer support specialist can convince the overdose victim. We need to treat people outside of the criminal justice system for this. So, and we're, again, this problem of dependency in this country, even if we took away today's heroin crisis, we still have alcoholism, we still have cocaine addiction, we have always had addictions, and we don't have adequate infrastructure to treat them.